This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. If you have not already, please review the introductory video for the background on this book. This part will cover meats under Chapter 8, Diet. This is part 35. You may think, well, I have to give up all meats. That's not the case. The American Heart Association recommends a diet that stresses vegetables, fruits, grains, low-fat dairy products, chicken, turkey, fish, nuts, and a limited amount of red meats. They also recommend 3 servings per week of fish high in omega-3 fats. That includes wild salmon, Arctic char, tuna, Atlantic mackerel, Pacific halibut, sardines, sablefish, black cod, rainbow trout, even albacore tuna. Now, some of these fish varieties have measurable levels of mercury, yet the mercury detoxification techniques covered in Chapter 4 will remove mercury and other heavy metals from fish, so don't worry about that. When we discuss processed meats, we're referring to sausages, bologna, ham, bacon, hot dogs, any meat that contains salt, sugars, fats, and preservatives. During a Swedish clinical trial conducted by scientists at the Karolinska Institute in Stockholm, Sweden, they found that men who ate processed meats had a 28% higher level of heart failure incidence. They followed a total population of 37,035 men, ages between 45 and 79 years old. None had a history of heart failure, heart disease, or cancer. 2,891 developed heart failure and 266 died. The men who consumed more than 75 grams, or about 3 ounces, were 28% more likely to develop heart failure than men who consumed less than 25 grams, or 1 ounce each day. Now, conventional cuts of fresh beef without any processed chemicals added do not experience any increase in heart failure. When choosing to eat red meats, it is important to note that there are 2 types of fats available in beef sold today. Now, beef that's been produced on feedlots contain high levels of omega-6 fats, typically 4 times more than omega-3. Omega-6 fats are inflammatory in the human body, yet beef cattle produced on open grass pastures contain mostly omega-3 fats, typically 2 to 1. So it's the healthiest fat possible and the best ratio. If you're going to eat hamburgers and steaks, then check at the market for grass-fed beef. Remember our grandparents, they lived long lives eating grass-fed beef. Today, the meats have changed for production efficiency. Even chicken is available with range-style grass-fed chicken. Look for any meat that you're going to eat and also eat in moderation. Generally, your protein needs per day only require 3 to 4 ounces of meat, no more, for the entire day. And also think about lamb. Typically, New Zealand lamb is grass-fed. It's raised in pastures. Some lamb in the United States is feedlot-fed. You might have to investigate and ask your butcher the sources of the meat. But the human body can survive even on 2 ounces or 60 grams of protein per day with no problems at all. So, in summary, meats are healthy if you choose the right ones and you keep the quantity limited. When you try to follow a vegetarian diet, there are many enzymes and amino acids that are just not available in vegetables. You may try to supplement them, but it becomes very complex and difficult to do. So consume a healthy range of meats with a healthy range of fats. My name is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available at Amazon in a print and Kindle edition, from the Apple iTunes Store in an iBooks edition, and from eBay in a print edition. You can also order from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida, 32702, and just enclose a check for $24 for the book, plus postage and handling. Thank you for listening.